टॉर्च, जस्ट फ्यू, टॉर्च में कुछ नहीं है, बस पढ़ लो, 5 मिनट का टॉपिक है. सो इन टॉर्च व्हाट यू हैव टू राइट आर स्टोरीज. ओके, this is stories of childhood that you will write, whatever you remember from NEET PG, just write. Okay, so what are torch infections? First of all, congenital torch का criteria होता है. The only thing I found useful from this torch article was that there is a torch infection ka definition. The definition includes 3 things: that it should present within 48 hours of birth or before in utero. There should be serological confirmation of the cause, and you will exclude any other diagnosis, right? So this is what is the definition or the criteria of torch. What does torch include? I'm not going to write that. I'm hoping you know that. Toxoplasma, other infections such as syphilis, parvovirus, R for rubella, C for CMV, H for herpes, right? So this is what comes under the spectrum of torch, out of which the most common is CMV. CMV versus toxo. So overall, to give you in a nutshell, macrocephaly chorioretinitis more in toxo, whereas cortical malformations more in CMV. Baby stuff, you all know that CMV is periventricular calcification, toxo is parenchymal calcification, but we are past that stage, right? So there's nothing specific like that. It is only for NEET PG level. That specificity doesn't really exist that much in practice, okay? So what you want to remember, that CMV usually leads to more cortical malformation changes, okay? So that is what you want to remember. So this is a table which is extremely non-specific, but you can write something like this in the exam and they'll think that you know a lot. Essentially, इसमें कुछ नहीं है. Okay, it's just random stuff. So you can write this thing only, that CMV is periventricular calcification, ventriculomegaly, write down 3-4 cortical malformations. You can have a lot of cysts here, okay? यही है. टॉक्सोप्लाज्मा में लिख देना कि एक्सटेंसिव बेसल गैंग्लिया, कॉर्टिकल कैल्सिफिकेशंस मिलेंगे, हाइड्रोकेफेलस, दैट्स इट. एचएसवी में ज्यादा आपको इन्फार्क्ट भी मिल सकता है. एचएसवी कैन लीड टू कॉर्टिकल इन यूट्रो इन्फार्क्ट्स, ओके? देन रूबेला, अगेन नथिंग स्पेसिफिक रियली. पार्वोवायरस कैन लीड टू अनीमिया. COVID-19, nothing specific. Zika virus. Zika virus is something which is a neurolytic virus. Did you know that? So it affects the neurons the most. So this is what will lead to microcephaly, right? So this is the most dangerous one out of all of the torch. Okay. Time gain compensation. What about time gain compensation? Essentially, as you keep going down, okay, anyways, we'll come back to it. So now look at the cases, okay? So now you just have to see the cases. So look at CMV. This is a case of CMV. What are the findings? Periventricular cysts you are seeing. You can also see subependymal hemorrhage. Can you see this? Another baby. You can see subependymal hemorrhage evolving in the periventricular cysts. So you can see this, how the periventricular hemorrhage has evolved to become these cysts. And you can also see some calcifications here in the frontal lobe, calcification of lenticulostriate arterioles. Okay. So what are the good case, right? Good findings of CMV. You can see that there is a periventricular subependymal cyst. You can see this hemorrhage evolving into periventricular cysts, and you can see frontal calcification of lenticulostriate. So these are findings of CMV. Another case here of CMV where you can see these diffuse ventricular ectasias. So you can see the dilatation of this occipital horn of the lateral ventricle. So that is what you are seeing, along with some periventricular cystic areas. So CMV, periventricular calcification, periventricular cyst. Another case of CMV where you are seeing some frontal, coarse frontal, itna coarse hai nahi, coarse frontal calcification. You can again see that on a gradient image, and you can see these periventricular calcifications again. So this is CMV. Another CMV where you see that there are calcifications and cysts which are noted in the periventricular aspect. तो क्या सीखने को मिला? सीखने को मिला that periventricular is the buzzword for CMV, where you will see the development of cysts, you may see hemorrhage, you may see calcification, right? So this is what we anyways knew. Toxoplasma, look at this, such gross hydrocephalus, right? So look at the marked hydrocephalus that you are seeing here, and you can also see these white subependymal calcification. So subependymal calcification and your hydrocephalus. Then rubella. Rubella में क्या दिख रहा है? You can see these temporal cysts. Wander नाप जैसा जो लग रहा है. So you can see these temporal cysts here. You can see subependymal cysts here. Right? More or less the same thing. So rubella can also show you these cysts. This is a case of herpes, right? Look at this. This is a neonate who's having seizure and right-sided hemiparesis. And look at this. Diffusion restriction mil raha hai. Right? I told you, right? That herpes can lead to infarcts also. So herpes can actually lead to vasculitis and lead to infarct-like presentation. So that's what we are seeing. You are seeing diffusion restriction in the right-sided peri-insular region. And it is also progressing into parietal, etc. So remember this, that if you see a neonate with stroke-like presentation, think of herpes virus, okay? Herpes encephalitis, right? It's something which will mimic a stroke-like presentation. So this is herpes encephalitis, HSV1. This is a case of COVID undergoing MRI at 5 days, showing supratentorial as well as infratentorial bleed. So you can also see some SH, right? You can also see some degree of SH here. And there are some subependymal bleeds, some frontal hemorrhagic bleeds. So this is what COVID can lead to, intracranial bleed. So what did we learn? That torch का question आया तो ऐसे ही है, बहुत non-specific, right? So just remember CMV, periventricular, toxo, more hydrocephalus, more macrocephaly, more chorioretinitis, right? IVH भी है, IVH भी था ना? Multiple foci of bleed ना? तो IVH तो है ही, gross IVH, right? Plus you can see frontal bleeds, subependymal bleeds, ठीक है? So COVID can lead to bleed. Zika virus can lead to microcephaly. Fine. So this is what you need to remember. Yeah. So first image is the bleed. All right. So this is what it was. एक recent advances का कर देते हैं. Should I change one? So this theory class, next class, let me just take it on recent advances then. ठीक है? Next में सारे recent advance वाले 4-5 topics we will finish. Okay? So that's what we have to do. Class PDFs, I will just check whatever is missing and I will do this tomorrow, okay? So tomorrow, just give me time. I will check out whatever is missing. The team is already collecting those from the faculty. Usually late ho jata hai from the faculty level. So they are collecting, but I'll ask them to just, I will personally check kya kya reh gaya hai. Okay? Fine? Okay. All right, guys, keep studying, please. Yeah, before 16th ही है, next class is day after tomorrow है, 12th को है next class. Time gain compensation क्या होता है कि आपको basically जैसे जैसे आप नीचे जाते जा रहे हो, anyways, your echoes are gonna be weaker, right? So that is what the relation between the depth and the gain. So as the depth increases, you just want to increase the gain, right? And at superficial levels, the gain is lesser. So that is all that there is. Okay. अगर उसका कुछ physics है तो वो मैं पढ़ के बता दूंगी. If there is some physics, extra physics, I will read and tell you. CA lung also we will take. CA lung can be covered up in one of the sessions only. ऐसे ही कर लेंगे. Is it difficult to get SRship at AIMS Delhi? It depends, right? It depends on how many seats are there, how many, where are you from? So there are many factors that they take into account, you know. अगर तो usually 25-30 seat होती थी हमारे time पे. So how the usual priority order goes is, you know, they'll select people from AIMS, they'll select people from PGI, Delhi. And then if they have seats, then you know, everybody gets an equal chance. So that's what they do. It is hectic. but not very, very hectic. I mean, it is hectic for us who were very spoiled, and we didn't have very hectic JR-ship. But otherwise, it's pretty chill. I mean, it's not very, very hectic. You get 4 to 5 duties in a month, night duties in a month. Night duties में सोने को नहीं मिलता इतना. You get 2-3 hours of sleep, not much. But eventually the number of duties keep decreasing. So trauma is a little tough, but you get to learn a lot in trauma posting. So it is hectic, but you will learn a lot. So not very, very hectic, but good enough workload. नाइट ड्यूटी के बाद ऑफ मिलता है. हाँ, मिलता तो था हमारे टाइम पे, अब पता नहीं, बट मिलता ही होगा अभी भी. ठीक है. ऑलराइट गाइस, ओके, थैंक यू सो मच. विल सी यू अभी रिसेंटली ओनली, सो आई डू रिसेंट एडवांस वाला क्लास. ओके, नोट्स का डिलीवरी विल स्टार्ट. द बॉल इज नॉट इन माई कोर्ट एनी मोर. Ball is off my court. Now it's all about how quickly now your delivery agent is coming, and I can't regulate that. But I think they should start in the next couple of days. They're packing the box and all only. So I mean, it's now in the final stages. अब आपके घर पे कब पहुंचेगी उसी पे है. ठीक है, तो हो जाएगा. Now you have been so patient. Just please be more patient for 2-3 days more, and you'll get them. Okay. Do let me know how you like them. Any corrections, any feedback. पढ़ लेना. काफी मोटी मोटी किताबें हैं. इतने टाइम से मांगी है, पढ़ लेना. Okay. So do let me know how you like. I have not included, there are a few things I would want to tell you about those books. I have not included every single lecture. Every single lecture is not there. Whatever I felt was important from your exam point of view, I have included. A few things like, no offense, but Gursimran's lectures were very, very image heavy. Something which you only had to see and understand, right? So I have not included a lot of those because वो देख के ही समझ आएगा. वो बुक में कुछ लिखा ही नहीं, उसमें सिर्फ images थे. So that's how I have just tweaked it a little. But whatever you need in the book, it's there, So whatever are important topics for the exam, I have kept them. And we can constantly modify them depending on your feedback and the topics that we cover. So let's see how you like. Okay. Yeah, उसकी main nutshell वाली क्लास मुझे ही लेनी पड़ेगी MSK की, at least for shoulder and knee, which I've promised. I'll be taking them in the upcoming days. But before your at least theory exam, I want to finish the miscellaneous topics only. ठीक है? Because वो देख लो ना, शोल्डर एंड नी की तो डॉक्टर सुविनय की अच्छी क्लासेस है. आई जस्ट सॉ कवर्ड ही है सारा, ग्लैड एल्प्सा सब तो है. लेबरल पैथोलॉजीज, सी शोल्डर पैथोलॉजी की क्लास हो चुकी है डॉक्टर सुविनय की, नी की भी हो चुकी है. उन दोनों की नोट्स है बुक में. ओके, सो यू कैन सी दोस. बट फाइन, आई विल ट्राई एंड टेक. बट कितना क्या 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 करेंगे ना, योर एग्जाम्स आर ऑल्सो कमिंग. सो इवेंचुअली आई टेक फॉर श्योर. Let's see. Let's try Aj. So next class is on recent advances, and then let's take it from there and we'll decide. Okay. Okay, guys. All right. Yeah, it's extensible. It'll help you a lot in the long run, right? Detailed MS के काम आता है बाद में भी. So it's good, even though they are extensive. No, एक बार देख लिया होगा तो next time revise करने में time नहीं लगेगा. So you'll find it useful only, particularly if you want to do MSK imaging in detail, right? So that will be helpful. He will take up pathologies next. Right, so he is going to take up pathologies next for sure. So I'll also take a brief nutshell session for you for exams, but he will be covering every joint in detail. So don't worry about that. Okay, offline class का plan है ना, नवंबर में है.